Good dialogue between physicians and people with MS is essential for good outcomes. It's important that people share goals of treatment, and we can only do that if we know what each other's concerns are. A recent study has shown that people with MS often don't discuss their concerns out loud with their physicians, either short-term concerns or long-term concerns. The only way a doctor can make a decision about someone's therapy and their MS is if they know what's happening. Some of that information we can get by MRI scans, but a lot of the important information has to come from the person with MS themselves. When we're looking to assess the activity of relapsing multiple sclerosis, there are 4 real measures that we look at. 2 clinically, which is the number of relapses that someone has had and whether there's been any clinical worsening over the year, and 2 that we'll look at radiologically, the number of new lesions there have been and whether there's been any shrinkage of the brain over time. People don't want to have relapses, they don't want early disability, so drugs that work on that are good. But ultimately as well, we are looking for things that are going to keep people well long term. Each of the 4 indicators we've talked about is an independent predictor of long term outcome, so we are looking where we can to affect all 4. My advice to someone with multiple sclerosis going on a new treatment is to find out about it as much as they can, to take it as it's prescribed, to make sure that they comply with any monitoring that's required, any extra visits or blood tests, but also to collect information for how they're doing on it. And the only person that knows whether you've had a relapse is the person with MS, so they need to collect information in that, and also to reflect on whether there has been any change in their disability from the last assessment.